Chances are you're here because you've got questions about your heart disease and this therapy known as EECP, external contrapulsation, a non-invasive treatment for angina or heart failure. I'm here because, well, I've undergone EECP treatment myself. I'm Cliff Johnson, and I'm not an actor or anything, so forgive me if my presentation is a little rough. You can be sure of one thing. I'm going to tell it to you straight, and straight from the heart.
Well, I just couldn't live a normal life. I mean, when you're in pain all the time.
If I went to the mailbox, I'd have to go slowly.
It was just a struggle for me to even get showered.
I would get angina driving my car.
If I would bend over to tie my shoe, when I stood up, I had angina pain.
I pretty much was couch-bound or in bed most of the time.
You just can't do anything without getting chest pains.
Did you recognize yourself? I did. I've been there. I had a couple of bypasses and a stent, but the blockages and the pain just kept coming back. I was pretty convinced they'd never see my kids grow up.
It took a real toll on me, you know, day after day after day, not seeing any light at the end of the tunnel.
I knew in my mind that you just progressively got worse.
I got to the point where I just said, I can't do this anymore. I can't live like this. We need to find something that can help me.
For 70 to 80% of the people who find themselves at this point, that something could be Vasomedical's EECP therapy.
There are lots of people out there having angina once a day, once every couple of days, taking nitroglycerin on good medical therapy, who might be able to be benefited from this procedure.
The patient who's going to benefit most from EECP is the patient that has already gone through conventional therapy and still has a diminished quality of life and continues to have symptoms.
We've treated people as young as in their 30s and as old as over 100. Basically, it's the patient who tells us that I have chest discomfort that's interfering with my ability to live life.
These people want to be more active. They are not willing to just be sedentary and continue to keep taking nitroglycerin after nitroglycerin.
It just wasn't the type of lifestyle I'd want to live.
It's not really living. It's existing.
These are people who are active, older people who want to continue to have an active life. And I think we can help them a great deal. 70
to 80% of our patients show a significant improvement after therapy, and that improvement continues to about 55–60% of them after 2 years.
Just like everything else in medicine, no therapeutic intervention is 100% successful. But we've found that the majority of our patients have had a significant reduction in their chest pain, and this has enabled them to exercise more freely, more vigorously, and to enjoy a broader spectrum of lifestyle activities.
I'm impressed that in a neighborhood of 75% of patients who go through this procedure, by the time they're up to 15 or 16 or 20 treatments, they're beginning to notice a difference.
EECP is pretty well tolerated. I have patients in their 80s and 90s that have been able to undergo EECP and have a very good response to treatment.
Nothing punctures the skin. There's no needles or catheters or anything like that.
It's a non-invasive procedure with lower initial risk.
My cardiologist, who I trust very much, said this is our best shot. We should do it, so I decided to go ahead and do it.
And there was nothing to lose by trying this.
I said, you know, this is going to work. And I had that idea all through it. This is going to work.
Having a good attitude increases your odds of success with any treatment. So does taking your meds, making lifestyle changes, and in the case of Vasomedical's EECP therapy, making the commitment.
It requires 35 one-hour treatments. That's clearly important right up front.
They've gotten to know me pretty well at the doctor's office.
So what's going to happen an hour a day, 5 days a week for 7 weeks?
Well, first of all, they're going to have their legs squeezed, whatever their heart rate is, 80 times a minute. And it's fairly vigorous squeeze.
There's pressure on the lower extremities, which does force blood flow back toward the heart, toward the central circulation, and jousts the body a little bit, but not to too great an extent. And in our experience, patients have had no problem tolerating it.
I fell asleep a few times. Or you can lay there and talk, or you could lay there and read.
They are carefully monitored, so the blood pressure is monitored, the pulse is monitored, the oxygenation is monitored. It's done in a setting where you have typically a nurse or a technician available to, stop it at any time. It's a very, very safe procedure.
How much easier can it get to get your life back?
The patient generally, after about 10 to 15 treatments, starts to feel a difference in terms of how frequently the angina is occurring, how severe it's occurring, how long it's lasting, and continues to improve over the course of the therapy.
That's what all the squeezing and releasing is about. It isn't at all random. Leads, like EKG leads, hooked to the machine help detect your heart rhythm. When the machine is switched on, the sensors, timed to your pulse, trigger the cuffs around your legs to inflate and deflate in sequence. The inflation of the cuffs squeezes blood from your legs, pumping it back to fill your heart. The cuffs become an external pump, assisting your heart. Enhanced External Counterpulsation Therapy, EECP.
It took about midway through the 7 weeks, and I started noticing a difference then. Just how I was feeling in general, the pain level, everything was slowly getting better.
Okay, but how does EECP therapy actually help? In medical terms, what's the mechanism of action?
EECP may in fact serve to alter the properties of the blood vessels themselves and make it easier for the heart to pump blood and for the blood to flow through the vessels to the body.
I'm really convinced the blood flow to the heart muscle is improved. The efficiency of the heart muscle is improved.
And what this does is it makes it easier for the blood to be pumped through the body and take some of the work off the heart, may expand the arteries of the heart so more blood can go to the heart.
So this relief of chest pain is presumably not just sweeping the pain under the rug, so to speak, the equivalent of giving an analgesic, but it represents a beneficial effect upon the heart and its blood flow.
Most of my patients who we're doing this on have angina and left ventricular dysfunction, so they don't have normal heart function. So it works in those patients, and I don't see any reason why it shouldn't work in people whose main symptom is heart failure.
I've treated a lot of patients with heart failure with EECP. They generally tolerate the treatment well. Not only do their anginal symptoms improve, but also their heart failure symptoms.
It seems the benefit from EECP treatment results from having all that blood quickly and vigorously return to your heart. Researchers think this forceful reperfusion produces the same effect as brisk exercise.
EECP may be like exercise training for people who can't exercise.
And that passive exercise, again, takes them to another level in which they can maintain an exercise program.
They'll start to be able to do more before getting chest discomfort.
In about 5, 6, 7 treatments, I noticed I wasn't as short of breath, I could do more, and it just got better.
They may even have their chest discomfort totally eliminated.
The effects after EECP varies. Some patients will have a very good durable response that will last 2, 3, 4 years or more.
In general, our experience is that majority of patients, overwhelming majority, don't need a second therapy.
If I need it again, without hesitation, I'll do it again.
About 15 to 20% of patients who've had a good response to EECP will undergo repeat treatment at about a year. And when they undergo repeat treatment, they also get a very good symptomatic response in terms of reduction in the severity of chest pain.
And with the same low incidence of side effects.
Vasomedical's EECP therapy gives you a head start on becoming active again. And the more active you are, the more active you can continue to be. EECP therapy sets in motion a spiral, an upward spiral towards better health.
The fact that you can exercise tends to help sustain the benefits. It also is true that it enables you to be more self-realized in terms of doing what you need to do in your life, whether it be caring for your family or carrying on a job.
The doctor's job is to make patients feel better. And I think we do in 75% of the patients we try this on.
It's almost been 4 years since I had it done, and I don't see any reason I would need it for another 5-10 years, hopefully.
And these are patients who are resistant to a lot of therapy beforehand.
Now after my last session, I can do all the things that I didn't know if I was ever going to be able to do again.
I couldn't cut the grass. Now I cut the grass with no problem.
Last September, we made a 12-day trip to China. Now, I'm 83 years old. I think I'm more active than most of my peers.
All the little things that you take for granted, you just get them all back.
I still carry nitro in my pocket, but I think it's just a security blanket.
To me, it's just a best kept secret in the world. When, it's such a wonderful thing and it's available.
I've told other people about it and encouraged them to check into it.
I've told doctors about it, and they have no idea what it's all about and how successful it is.
They gave away the free t-shirt, I'd wear it all the time.
I told you I'd give it to you straight. Basel Medical's EECP therapy changed my life. I sincerely hope it's the answer for you too.
Everything worked out so great. I still can't believe it happened.
Every day is a gift.
Talk to your physician or healthcare provider about Basel Medical's EECP therapy to see if it's right for you.